No disclosures. So we're going to start by talking about just general changes in thinking and behavior in Parkinson's. And Parkinson's affects more than just movement, and it can affect a wide variety of different aspects of thinking, of behavior, and changes really vary across the individual. So some may have some symptoms, all symptoms, minimal symptoms, but we'll kind of talk about this more generally. So the types of cognitive changes you might see in Parkinson's include some difficulties in thinking speed, processing speed, might feel a little slower, executive functions. These are like the higher order functions of planning, multitasking. When I talk about multitasking isn't really a thing. What it really is switching your attention from one thing to another. So you're focusing on this and back and forth. So it's really just attention switching, and can be a challenge. Working memory, that's holding information in your mind and doing work on it. So for example, someone gives you a problem to solve in your head and you can't write it down. You have to kind of hold that information in your head and do work on it. And then organization kind of goes along with planning. Attention is also an area that you can see some difficulties in. And you may see some attentional fluctuations, some ups and downs in attention. For instance, one moment someone might kind of be zoning out a little bit, kind of not really present, but the other moment really sharp, spot on. So if you see some of those fluctuations in attention, that's to be expected at times. And visual functioning, visuospatial functioning is really how your brain perceives your visual world, your environment. Can impact depth perception, can impact how you see things in front of you. And we'll talk a little more about these things later. And then memory. I would say everyone comes to me saying they have memory issues. Memory is a really complex system, and with Parkinson's, it's more sometimes the learning, getting that information in, but also the retrieval. It's less similar to something like Alzheimer's disease, where you get in that information, but it doesn't quite make it to the filing cabinets in the brain. For Parkinson's, you get in that information, your brain puts it in a file, sends it off to a filing cabinet, but then when you go to retrieve that information from the filing cabinet, it may be stored. Maybe it was a little disorganized when it was stored. You have to search through the filing cabinet a little bit more. And so cues, reminders, someone says, remember we talked about this, this, and this, and then they can say, oh, right there, I got it. And those retrieval cues can be really helpful. Behavioral changes can also happen. Depression, anxiety often occurs pretty early and common. And some apathy, just low motivation, not really interested in things perhaps they used to be. Impulse control. Sometimes it's a little bit harder to kind of put on the brakes, so to speak. Maybe a little more impulsive in general. And it can lead to some issues at times. Hallucination and delusions. These are especially in more advanced stages, or with dopamine therapy. So certain medications that increase the dopamine in the brain can actually lead to some of these symptoms of hallucinations, usually visual hallucinations. Some agitation and irritability, and some more kind of repetitive behaviors. Someone might be more what we call perseverative, kind of getting stuck on something, and it may appear a little more kind of obsessive compulsive in nature, where you kind of keep doing the same thing. So assessing cognitive change, this is what I do. As a neuropsychologist, I look at individuals, determine where they may be falling, and determine their strengths and weaknesses. So why do I do this? Well, first it defines the cognitive behavioral symptoms that someone's feeling and the level of change, which we'll talk about in a moment. It also provides some insights into differential diagnosis. Are these difficulties we're seeing related to Parkinson's? Maybe they're related to something else. And we can get some more information on that. It's helpful to monitor change over time. So you can get a baseline for evaluation, check up in a year, 2 years, and kind of see how things are changing. Are things staying pretty stable? Maybe improving. Maybe you've worked on mood, on other things that are pulling some of the thinking systems down, and you've seen some improvement. Or maybe there's been a little bit of a decline, and we can take a look at that. And determine strengths and weaknesses of the individual and how that's impacting their daily life. But what I think is most important is that we spend a lot of time with the individual, so we're able to really personalize some recommendations based on these strengths and weaknesses that we determine from the cognitive profile. And this can really help individuals, their care partners, inform kind of, you might start having some trouble remembering medications, or, it might be a little bit harder to manage some household tasks, things like that, and we can kind of problem solve together. So as a neuropsychologist, how we measure cognition, we start out by just establishing shared goals with the individual. What is your goal? What are you looking to find out? And it's really helpful to have a reliable care partner come along, because even if I think I'm having some difficulties, someone else might think, well, actually, you're having some other difficulties that I'm not noticing. So it's helpful to have some, multiple points of information. Then we obtain some data. So I'll talk to someone for 30 minutes, an hour, to just get a sense of what you're experiencing in your daily life. How is this looking? Also, social history, educational history. Have you always had some attention issues? Do you have an underlying diagnosis of ADHD that has always been there, and maybe things are getting worse, maybe not? And we perform a standardized cognitive assessment. So what that means is we take your information, compare it to someone your same age, sometimes your same education, and see where you're falling on just kind of this normative level. And then provide feedback to the individual. So our process in a more comprehensive evaluation, and we as neuropsychologists do these more comprehensive evaluations, whereas your neurologist can do some brief screens to track things over time, but maybe not give you that level of detail. So in our comprehensive evaluations, we'll start by estimating where we think you should be falling. We have some measures that help us do that. So what was kind of your historical level of functioning, and then examine a variety of different domains of thinking, like memory, attention, this executive functioning that I just mentioned, language, visuospatial functions, motor functions, emotional functioning. So it's a really comprehensive evaluation, and we take all of these points and put them together. But what's interesting, our tests, this is kind of some typical visuospatial tests. We might have someone copy a figure. And you can see this individual is having a little bit of difficulty copying those figures. And it correlates pretty well with some changes in the brain that we see. So next step is, well, what's the level of change that we're seeing? I like to say that these are labels that describe levels. This is just like, where are you falling? It doesn't tell us what's causing it. That's something that we'll think about later. And as I mentioned, it could be Parkinson's disease, but we want to rule out other things as well. But is it, no perceived change, some subjective cognitive changes, meaning I have concerns about myself, but there's nothing that's being picked up on testing. Is it this term mild cognitive impairment, or otherwise known as mild neurocognitive disorder? Or is it more significant, this kind of more dementia level, also known as major neurocognitive disorder? And that can be in a mild, moderate, or severe stage. So as you can see here, I'm not sure you can see my, probably not, cursor on here, but in normal aging, we're going to see a little bit of a decline, but with MCI and dementia, those declines are kind of more significant than would be expected with normal aging. So MCI, or mild cognitive impairment, mild neurocognitive disorder, they make it confusing with lots of different names. Again, it's just a label, and we're just checking off boxes. So there has to be concern for change. That could be your own concern, a care partner's concern, a physician's concern, but there's some concern that things have changed. Mild difficulties in one or more cognitive domains that we talked about, compared to that normative data sample, and pretty much intact activities of daily living. You're functioning well, you're managing things well. You might have some mild changes with more complex things in that they're more effortful. Maybe you're using a calendar that you never needed in the past, or things like that. Maybe it's just a little bit more of a challenge, but you're able to compensate. So that's MCI. When we get to dementia or a major neurocognitive disorder, again, this is just a label. There are many different types of dementia out there. But what dementia in itself means is there's just more significant difficulties in one or more cognitive domains. We're pretty sure it's a decline from where things used to be. And the kind of main point that differentiates MCI from dementia is you need more help in your daily life. So maybe just getting more assistance with things like managing finances, remembering appointments, remembering your medications. It's just in general that the cognitive difficulties are severe enough to impact your daily functioning. So as far as brain health approaches, there's good news. There are things we can do to help prevent and kind of push off some of these difficulties. So in 2017, The Lancet came out with a great paper that suggested that dementia actually might be preventable for 35 to 45%. In 2017, they determined that there are early life factors, midlife factors, late life factors. So things we can do at each stage of our life that can help really prevent cognitive change, or again, push off cognitive change as much as possible. The goal here is reducing risk and reducing these risk factors for cognitive change. And that goes for all of us, really. So again, in 2017, they identified these potentially modifiable risk factors, meaning these risk factors that we can work on, we can change. Initially in 2017, there were 9 existing risk factors. The first one is lower education, and maybe you don't want to go back and get more education later in life. That's fine, but there are other things that you can certainly do as well. Things like managing blood pressure, hearing impairment in midlife is actually a risk factor. So hearing aids, just getting hearing aids once you're having difficulty with hearing can be really helpful. Smoking, obesity, depression, physical inactivity, diabetes, and so lower socialization. Those things were also identified. And then in 2020, they added a few more risk factors, things like alcohol consumption, head injury, air pollution. And in 2020, the potentially modifiable risk for dementia was actually increased to 40%. So 40% of dementia is preventable to some extent by managing these risk factors. Then in 2024, they came out again and said, actually, maybe 45% of dementia is due to these modifiable risks that we can really manage. So again, they identified a lot of the same things. So education, hearing loss, high cholesterol, managing these things, depression, brain injury, physical inactivity, diabetes, smoking, and so on. So what can we do? Get exercise, don't smoke. I know some of these are, easier said than done, but we'll talk about it. Reduce or stop alcohol use. There's more and more evidence coming out that says any alcohol use is not great. I know, but reducing alcohol use as much as possible is recommended. Again, correct hearing, because hearing loss is a risk factor. My dad was having some hearing issues, and the only way I got him to get hearing aids was giving him this tidbit of information that it actually increases your risk, and there you go. Manage mood, eat a healthy diet, sleep well, and manage co-occurring medical issues that really impact the heart or the blood flow to the brain. And what we do know is that what's good for the heart is what's good for the brain. And so you'll notice a lot of these difficulties have some relation to heart health as well, like blood pressure, diabetes, sleep apnea, things like that are these risk factors for your heart that can also impact your brain. And so that brings us to the American Heart Association that came out in 2021 with a similar list. They identified in 2017, actually, just kind of some simple 7 risk factors that we can work to modify. So smoking, obesity, physical inactivity. Here they're recommending 150 minutes or more per week of moderate intensity exercise. That's a little over 20 minutes a day. Or they're recommending 75 minutes or more of more vigorous intensity or combination exercise, and that's a little over 10 minutes a day. So it's doable. And healthy diet. So components of healthy diet that they included here are just low sugar, high fiber, high folate, high omega-3 fatty acids, low saturated fats, and trans fats. And so those are kind of some things that can help, again, reduce our risk. They've got some suggestions for cholesterol, blood pressure, glucose, so that's really more kind of related to the diabetes I mentioned earlier. And just so keeping those managed, if you have it, fine, manage it, take your medication on time. That's going to be really important to reduce risk. Then in 2021, they added these additional factors, so low mood, low socialization or social isolation, excessive alcohol use, sleep challenges, education and hearing loss. So I'm going to start by talking about exercise. If there was any pill that carried the benefit of exercise, it'd be considered a miracle drug and everyone would be taking it. So exercise is really important. This is one of those things, again, I know it's easier said than done, but what I think is really important is that any exercise helps. This is a bit of an old study, but I really like it because it shows you that, and this is a large population-based study of over 4,000 participants. And after adjusting for age, sex, education, the exercise groups had about a 40% lower risk. And I think what's really helpful here is you can see you've got these kind of 3 tiers, right? Low exercise, moderate exercise, high exercise. The high exercise was 3 or more times per week with intensity greater than walking. So just something that's a little bit more than walking. The moderate exercise group was 3 or more times per week of walking. And then the lower was just kind of doing something, but less than that. And you'll see here, there's a really significant change between the no exercise group and the exercise groups, but low exercise did really well. So it's pretty comparable to moderate and high exercise. So your benefit for just doing anything is really, really quite significant. So getting out there, If you can walk 3 times per week, great. But if you can do anything, walk a couple times per week, or chair exercises. Wellness Works is a great program to look into. I think, again, what's really most important is just any exercise helps quite significantly. And then sleep disorders. So sleep difficulties are complex because they can be tied into a lot of things that can also cause some difficulties. So I might not be sleeping because I'm anxious, I'm in pain, all of those things. But it's normal for sleep to change as we age. But poor quality of sleep is less normal, and may be, again, in the context of a lot of different factors. But what this study found was that increased sleep latency, or trouble falling asleep, or decreased sleep duration, like not getting enough sleep, is more associated with dementia risk. So focusing on sleep is really important. And also, they included these kind of sleep hygiene strategies that I give to basically anyone I work with, because it's so important. So, you want to focus on getting about 7 to 8 hours of sleep, get up at the same time, fall asleep at the same time. Again, I know a lot of this is easier said than done. Limit the use of the bedroom outside of sleep and intimacy. So don't watch TV in your bed. Don't be on your computer. Don't be on screens. That's also going to kind of make it a little bit harder to fall asleep and even stay asleep. Exercise, keep the bedroom dark, quiet, cold, and expose yourself to light during the day. But if you see over to the right, people who had about 30 minutes or more with difficulty falling asleep had an increased risk, and sleep duration of 5 hours or less was really the most significant risk. So we want to shoot for 7 to 8 hours and do our best with that. It's not going to be perfect every day. That's okay. Just try your best. So social and cognitive engagement is also really important. Individuals who had less frequent social contact had over 50% increased risk. So socialization supports brain networks, helps mood. Even small interactions are helpful. Being here today is great. And it's never too late. Both early and late life cognitive engagement are important. And other things you can do to kind of engage your brain are get involved in new tasks. If you always did Sudoku, try a crossword and find something that's specific to you. Even if you're not good at learning languages, trying to learn a new language, trying to learn a new instrument. You don't have to be perfect. You don't have to learn the new language. It's just challenging your brain in different ways can be really helpful. And so stress, mindfulness, and thinking. So stress affects attention, as does depression, anxiety, and really effective treatment of depression and anxiety is one of the best steps to boost our brain power. Mental health is really crucial because if you think of it as layers, you might have some difficulties with Parkinson's, but when you're stressed, when you're anxious, when you're depressed, when you're not sleeping, it kind of pulls some of these things down. And so we want to remove those as much as we can. So working on stress, mood, sleep, all of those things can be really helpful. And I like to suggest mindfulness. Mindfulness has been shown to be really efficacious in improving focus, improving mood. Mindfulness is currently defined as this process of attaining a certain quality of attention to moment-by-moment experience. It's just training your brain to stay in the present moment, to be actively engaged. And mindfulness has a lot of other benefits. So enhanced immune response, increased activity in certain brain regions, helps manage anger, emotional irritability, just decreases some of those ruminations that we might have with anxiety, decreases low mood, depression, anxiety. So it's a really helpful tool, not only to manage some mood symptoms, but also to help boost attention. And I tend to recommend just pick one task a day. It could be brushing your teeth, for example, where you're really focused on the senses. How does it feel, taste, smell? And a thought will come in, as they do. That's okay. Don't judge yourself for that. What you're going to do is refocus. So that thought comes in, and I'm just going to refocus to the senses. So I'm refocusing on the present moment. And doing that once a day will train your brain to just be a little more present in general. And so some strategies that can be used, these are a little different. We talked about risk prevention, right, and how we can kind of help push off some of these symptoms by reducing our risk. But if we are having some symptoms, there are things we can do in our daily life that can be really helpful as well. So I'll start by talking about memory, because again, even if someone's just having kind of some retrieval issues, memory is a big complaint in daily life for people who, just anyone really. And so there are internal strategies, things like mnemonics, chunking, like if you're given a list, chunk it into groups, things like that. But I think external strategies are really helpful as well. These are things that you can really put in place in your home and in your daily life. So using a pill box. This is an easy thing you can do. And I don't care if you have just one medication, use a pill box. It helps because then, the next day you look at your pill box and you say, oh, I forgot yesterday. It helps you keep track of whether you're taking your medications, and it can help others kind of keep an eye on it too, if necessary. A memory table. So a memory table is just, it could be a memory spot, a memory table. It's just put things in the same place. So I walk into my house, I put the key on the key ring, and that's where they go. So in the past, I may walk into my house, be really stressed, thinking about a lot of different things. I put down my keys, and then later I can't find them. And it's not because of memory, it's attention. I was not in the present moment. I was off thinking about who knows what. And so really just kind of keeping things in the same place, being actively engaged when you put things down can be really helpful. And even talking to yourself can be helpful to remember things. Just that helps bring your attention. Again, it's all about active attention, really. Brings your attention to the present moment. So if I'm parking and I'm worried that, it's a huge parking lot, I'm not sure if I'll remember where my car is, I'll say out loud, I'm parking in D5. And it may be silly, but it helps bring my attention to the moment so I can help remember that later and help make sure I learned it and actually got it in. Alarms can be helpful with retrieval. Keeping a memory notebook can be nice. So if you find you're forgetting things, keeping things all in one place is good. So you don't have sticky notes everywhere, and keeping things organized. And you can write down things in the notebook where, what I did today, what my to-do lists, and even in later stages, if someone's having difficulty remembering later that someone visited, someone can write in the notebook as well. Reminders, again, similar to alarms, it's something that triggers your memory. So remember we talked about some of those difficulties retrieving information out of that filing cabinet, and reminders can help with that. A whiteboard. I like suggesting a whiteboard in some well-trafficked place in the home. It could be the kitchen, wherever. And it could have upcoming events. It could have the date. It depends, it depends on the individual and what sort of difficulties they're having, but it's helpful to have a place that someone knows to go to get information. And then, sometimes people, because of visual difficulties, do have some trouble with navigation and may get lost or turned around, and especially if there's a move. So moves can be pretty disorienting. So putting some visual cues, in the hallways, things like that, to really cue someone to help them find their way. I also like to discuss airless learning. This is really careful titration or increase of difficulty level so that the person learns without resorting to trial and error and has a really positive experience with increasing challenge. This can be effective for learning a specific skill or a task, like, say, someone got a new alarm system and is learning how to turn it on and turn it off. You want to start by, say you come home and that person is in charge of just pushing the first number of the alarm code. Say your alarm code's 1, 2, 3, 4. So you come home, that person always is pushing one. They're not failing. It's a positive feeling, not to do well. And then after that task is really well ingrained, then you switch to 1, 2. And then over time, 1, 2, 3. Over time, 1, 2, 3, 4, enter. And so it's really just kind of focusing on this one task. It doesn't have a ton of transfer to different tasks, but it can be helpful if there's something that's really important that's necessary to learn. And so for visual system issues, I often tell people, you may have healthy eyes or good eyeglasses, but you can have trouble seeing or perceiving things because of changes in the visual brain system. So using other senses, touch, words, smell, and really keeping things organized is most important. It's going to be very hard to see something in an office that looks like this as opposed to an office that looks like this. That's for anyone. And so the other thing is that if someone is having some difficulty with visual systems, it's oftentimes really hard for them to see the forest for the trees. So if you have an office that looks like the one on the left, when you're looking at it, how are you going to find one thing when you have a table full of a lot of different things? It makes it 1,000 times more difficult when you're having difficulty seeing the bigger picture and your brain is focusing on one thing at a time. So basically, you're looking for that one thing across the table. It's going to take a while and it'll be a challenge. Other things that can be helpful are just environmental modifications, changes in the home. So decreasing clutter, like we mentioned, storing only a few things together. Proper lighting and reducing glare can be helpful. Oftentimes hallucinations, if they're occurring, will occur in the evenings because it's dark. It's a little bit harder to see. So reducing glare, using proper lighting, using night lights. You can mark stairs with different colored tape to make it more easily seen. Changes in floor levels. Applying decals to a sliding glass door can make them more visible. And then you can always get referred to an occupational therapy in-home assessment, which they're really great. They'll come in the home, figure out, what do I need? Do I need shower bars? This rug is sticking up a little bit too much. It's a fall risk. So that can be helpful. And then we talked a little bit about executive and functions and attention earlier. And we talked about kind of this active attention, this mindfulness. So talk to yourself, slow down, engage the senses, take time to notice the details of the environment around you. Work in a quiet, distraction-free environment. And kind of pairing things or making connections can also be really helpful. So if you are adding a new task, like you're adding medications and you've never taken medications before, connect it to something that you're already doing, like brushing your teeth. I brush my teeth and then I take my medications, or I make my coffee and then I take my medications. Making those connections, it can be really helpful, because in the brain you're kind of piggybacking this new task onto something that's already really well developed, that's a habit for you. So you've got these networks that are already that have already kind of have this pathway for your habit of getting up and making coffee. If you just piggyback that new task onto this old task, it can be really helpful. Increase in organization, structure, keeping a daily schedule can be helpful, and then just kind of visual cues and reminders. So for instance, sometimes people might have trouble with prioritizing or figuring out a sequence of something if they're having some executive difficulties. So you can have visual reminders. So this is step 1, this is step 2, this is step 3. Sequencing out a task can be really helpful, because sometimes it can be hard to kind of determine, for an individual to determine where to start, and kind of giving them a roadmap for that can be great. I included just a few apps that can be helpful. Technology is really, it's kind of a new world out there. So there are some good apps that can help track medication management, things like that. Apps you can take notes on. Also just talking watches, alarms, things like that can provide those reminders we need. And audiobooks can be helpful too. If you're having some difficulty seeing, listen instead. So in conclusion, just wrapping up here, the evaluation can aid in these creation of these practical strategies. And changes in Parkinson's can include a lot of different things. And everyone's different. Symptoms might be very mild to more significant. And include some kind of more higher order executive functions, attention, visual skills, and we talked about that memory retrieval. And the good news is preventing cognitive decline is within reach by reducing risk factors. Exercise, diet, vascular health, your heart health, all really important. So take care of your body to take care of your mind, and use some strategies to stay organized. So, because one of the most common memory complaints I get is trouble remembering names. I'm going to leave you with that right there. It's one of my favorites. So thank you, everyone.